Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine for the individual, the family, the society, and the whole. And today is a very special guest and topic, and the title is Dr. Peter McCullough's Clinical Pearls in Assessing and Treating Spike Protein Related Heart Conditions, such as blood clots, myocarditis, pericarditis, atrial fibrillation, heart attacks, and stroke. And in the era of multiple COVID vaccines and repeated COVID infections, he has over 1,000 peer-reviewed publications, 700 in PubMed, and I do believe he's the most published in cardiorenal medicine. He can probably check me on that. And also, I think he's probably the most published in producing articles in PubMed on COVID-19. Is that correct?
Yeah, I'm certainly up there in terms of clinical publications on treating the viral infection and the vaccine sequelae. And, it's a great honor to join you on the program. We text back and forth and clinical pearls and been, you and I have, in a sense, been forward facing in the trenches, so to speak, through the entire pandemic.
Well, I have a thank you, but it relates to this whole issue. So I've been a primary care integrative medicine PA for 43 years, and so in our world, we're doing kind of what you have moved to now. We were trying to gently take people off medicine if we improve their lifestyle enough and reduce their chronic disease illness. So in the midst of COVID, when I first met you and digging around as things were getting taken off the internet, I found your McCullough protocol through the American Association of Physicians and Surgeons. And I got COVID myself in August of 21. And as I read your information, I treated myself. And then after August of 21, the doors opened. I mean, I put myself on a list. And from there on, and I think the audience ought to know, you have educated. I've listened to every single one of the McCullough reports 3 times, the 2 that you put out per week. And so how do you keep up? And I share this with the audience. I have links to your foundation that'll be underneath this interview. I actually send people to your website, petermccullough.com, and I'll just say, go there, and you will see the algorithm for the detox, the spike protein detox halfway down the page. You'll see the algorithm for the McCullough protocol on the page. And the very bottom is a link to your 2 podcasts, that links to your 2 McCullough reports. And then also on that page are clips from you doing, and this is part of your intro, you've spoken all over the world. You've spoken at the European Union about the vaccines, and you've spoken in Congress, Senate, capitals. So I don't think people realize well, they do realize once they've met you, but for me to share with people what a resource you are and how many traditional areas you have reached around the world. This is not just some alternative doc talking off the cuff about how he thinks his opinion is about, COVID-19. So for me, it's just a full circle. I greatly appreciate it. I went through cancer treatment and used repurposed drugs. So, in fact, I have my 2-year anniversary from getting the diagnosis. And, I've used repurposed drugs that I learned from you and other people in this whole milieu of evolving COVID. Yeah, it's a funny story. I never get vaccines. So all my career, I never got any vaccines. And for some reason, I lost my mind and said that the COVID vaccines wouldn't hurt me. So I got 2 in January, February of 2021.
Oh,
and
no.
Yeah, so that's all right. It was a gift. And so anyway, turns out I treat myself. And I'd been experimenting with ivermectin and hydroxychloroquine before that as a prevention because I was around people. And to make a long story short, I've been integrated that into my treatment protocol. So this is like a full circle for me.
To say, what type of cancer did you have?
2 years ago, it'll be my 2nd-year anniversary, and my 2-year anniversary, I got the diagnosis. I had colon cancer, 6.4 centimeter mass, and hepatic flexure. So the traditional approach is you got to get it out because you can have a rupture, sepsis, and die. That's the biggest emphasis that I got from everybody. And it was at that time, though, I was starting to learn about treating with ivermectin, and patients would come in here, and I was going through that whole transition. But it really started with COVID, learning the COVID treatments, and then going to all the conferences, and then they started to evolve with that. So we do IV vitamin C here in the clinic. So I said, give me 2 months, and let me do the repurposed drugs. So I did ivermectin, albendazole, and a few other
Mm-hmm.
drugs and nutraceuticals. I did
Mm-hmm.
IV vitamin C 3 or 4 days a week,
Mm-hmm.
and I respected my oncologist and my surgeon and my gastroenterologist, and I just said I want to try this. So to make a long story short, it was kind of like a standoff. It never spread. It never went anywhere. Never had an elevated CEA,
Mm-hmm.
but it grew a little bit. Though it didn't show it on the scans, but when it was removed, it was an 8 centimeter mass. So I
Mm-hmm.
hung around and I did this for a year and a half. And so everybody's looking at me. I'm getting pretty thin. But I kept working and I just kept trying. And to make a long story short, in January of this year, I said, God, if you want me to, have surgery, let me know, but don't kill me. So I had an event that was an event that said, all right, now's the time. So
Mm-hmm.
I got it out. I chose not to do chemotherapy. I'm still on 1 milligram per kilogram of ivermectin.
Mm-hmm.
Bendazole makes my liver enzymes shoot up, so I'm on mebendazole.
Right.
And so I got through my 8 month CT scan. It's clear, and so I'm going to have my follow-up colonoscopy. And
So no spread to the liver.
never.
And
So
yeah, and from the time the 6 centimeter colonic mass was identified to the time you got it out was how long?
it was a year and 6 months, 7 months.
Wow.
So it was from September of 23 when I got the diagnosis, but I know I had it in the summer. But September of 23 all the way till January of 25.
Wow.
And
And did you lose weight, Kirk?
yeah, I'm thinner now. Yeah. So the problem was, I never had a normal bowel movement since then. I was losing weight. I was getting anemic, and that was the hard part. I got my hemoglobin got down to 9,
Yeah.
and I was getting thin, and I had someday I'll share with you I probably got the highest dose of ivermectin ever taken. I experimented with myself. I actually went up to the range Dr. Mackus. Well, he had a
Yeah.
kind of a summary of ivermectin, and it was 2.5 milligrams per kilogram. So I had tapered up to that, and I was stuck, and it wasn't going anywhere. So I tapered up higher, and
Well, what's the total highest milligram dose per day you took?
275, I think.
275 milligrams of ivermectin a day.
Yeah, it was 4.5 milligram per kilogram. So what happened was I had 45 milligram capsules.
Mm-hmm.
So you can get the 12s or you can get the 45. So I was tapering up, and I was going slowly. Nothing happened, but I had a syncopal episode. But in the repurposed drug world, it was mentioned to me to try propanolol. It has an anti-cancer effect, and I have a low blood pressure and slow heart rate anyway. And I was a little hesitant, but I just tried a teeny dose, 10 milligrams. I don't want to blame it all on ivermectin, but what happened was that combination, I'd done some fasting. People do fasting before that, had a couple days, and that combination, and I passed out like boom.
Yeah, so
that was the first.
propranolol, fasting, had the cancer, so that fed. So you took it up to pretty high dose ivermectin. Any side effects with the ivermectin at that high a dose?
Well, so here's the interesting part. So I get admitted to the ER. I'm a little embarrassed. I tell him what I did and spent the night, got MRI, and everything was fine. And he just said you probably had ivermectin overdose. But I that's the short story. I stayed off for a month and then retapered back on, and I wanted to get up to the 2 milligram dose per kilogram dose. That's the heavier treatment dose. And I tapered up to that. But down the road, I had another event where I woke up and my speech was slurred. This is about 6 months later. My speech was slurred. I looked at my phone and it looked like a kaleidoscope. And I missed getting to my 7 o'clock patient for the first time I've ever done in my life. I overslept. And I went to the hospital again that time. And they just said I was exhausted. I told them I took ivermectin, and I got a neuro workup, everything. And I think it was the ivermectin. And what I've observed in some people is, if you give ivermectin, not at a large dose, but if you go up like instead of 12 milligram or 20 milligrams, if you go up to like just start at a 0.5 milligram per kilogram, let's say 45 milligrams, some people get visual disturbances, and it's real clear.
Well,
And
Kirk, I've had that myself, And I'm not sure if the correct term is a phosphine or not, but it's like a kaleidoscope kind of fuzziness that comes around the vision. It's happened to me twice now on ivermectin, and it's a little scary driving. And I remember that, and I just like, whoa, this doesn't feel good. So, and I think that happened to me at ivermectin at 48 milligrams a day, and then I took it at 36 milligrams a day, and I was taking it because I was sick. But there are some people. I'm not sure I'll take ivermectin again, just because that just kind of freaked me out.
Well, what I've observed in the cancer patients that come here is this: if you'll taper up, like I'm only starting at, like, when you write a prescription for it, is, if it's not at 12 milligram, but I write 20s, and if I go up in 20 milligram increments to whatever that 1 milligram or up to maybe 2 milligram dose, it doesn't seem to happen. If I start with a bigger chunk, so to speak, that's when I've had people go, whoa, I had these symptoms. So, most of the people, originally got this stuff from India or wherever, and it was 12 milligram per kilogram in the little things. So they were tapering up slower. But when we get the compounding, it's easier. You're trying to save people pills. And so I've lowered my dose, and I've observed it being less. But right now I still take a 45 milligram, and I take 2 12s. And after this, if this colonoscopy becomes clear, I'm going to taper down. I'm at 67 milligrams, which is 1 milligram per kilogram for me.
Okay, but let me ask you a couple of questions then.
Sure.
Do you think this colon cancer, do you think it's a vaccine turbo cancer?
Well, I look at this from multiple levels. So you could time it. If I just wanted to jump into the camp of, well, first of all, when COVID came, I was a plant-based person 100%. So let's backtrack to August of 21, when I got in November, December, January, February, I got the vaccines. I was fine till I got my infection in August. So I treated myself with, low dose, 0.5 milligram per kilogram, and did zithromycin, did hydroxychloroquine, IV vitamin C, back to work in a week, no problem. But what happened was, I dramatically changed my diet during that time, and treating COVID and other things in my life was one of the most stressful times. Like, these were long days. And I switched my diet. I switched over to a more animal protein diet, and it was sloppy. I'm saying this, and this is a plant-based person for 25 years. And so that happened at the same time. A very stressful year. Didn't eat a good diet. I don't want to blame it all on meat. That's not what I'm saying. I ate a very poor diet, and I got the vaccines, which I never get. I don't even, I know you've had, your flu vaccine every year. I never get vaccines. I was with Andrew Wake. I heard Andrew Wakefield speak in 2000 at the Autism Research Institute. That's how far I go back. And anyway, I didn't take vaccines. But what happened was, I think it's a combination. But I also think there's a spiritual aspect to this. I think that there's a time for me to change. Like, I'm here doing this right now, getting back to my roots of what I love to do, which is to teach and to share information, let people make their own decisions.
Yeah, so, I can tell the audience for sure, Kirk, is because we've been communicating for so long. But let me ask you: did you have a previous colonoscopy, or was it?
No, so I never did. No, I never did. But here's what happened: as I was having, you drink your coffee every morning. Well, coffee. I'm not like a big coffee drinker, but coffee would always give me irritable bowel. Let me be polite about it, okay? And 1 cup a day. So when I went through this stressful time treating COVID, after August, treating COVID, I had some family issues. It wasn't an easy time, So my bowels were off. And I think that, no, I never had a colonoscopy. But what happened was, when we got through the year in August of 23, I had switched from the HMO Kaiser to a private. I became Medicare, and we order lab stool exams all the time here, alternative stool exams. So I said, my bowels just changed, and I had some cramping. It was in August of 23. I had some cramping. It was different than the IBS. And I go, all right. So I do a stool exam, and I have blood in it. No pancreatic enzymes and blood in it. So I go, all right, then I'll do the Cologuard. Do the Cologuard, it's positive. And then that led me to my 2-year anniversary, which is this Friday, of getting my first colonoscopy. And she, you wake up and you're all fuzzy, and she's got these beautiful pictures of this mass in your colon, and you say, I've marked it. So where the surgeon can cut it, they mark it. And I had an ulcer too, which totally weird, but I had an ulcer. So they wanted me to go get, surgery right away and 8 weeks of chemo, and that was it. And that whole interim.
Ron, hang on, Kirk. Did they want the chemo before the surgery or after the surgery?
No, they were gonna cut it out, and then you have 8 to 10 weeks of chemo, and then
Okay, so they
you're
wanted
done.
surgery first, then chemotherapy.
Right. And the constant thing said by everybody is this, is that, and there was never an elevated CEA, never, ever. There was never any metastases. I had probably 10 CTs over that year, chest, abdomen CTs, and then I had 5 PET scans.
Let me just give you my commentary on this. So for a colon cancer, from the time of the very first cancer cell to the time there's an apparent cancer, some little ditzel that you can see, is about 5 years. So if you had a 6-centimeter colonic mass at the time of detection, which was 2023, I can tell you this cancer probably started in 2013, probably started 10 years ago.
Or it could have been aggravated by the turbo cancer and my change in, the vaccines and my change in.
Okay, well, that's it. But I think you've had the cancer since 2013. I bet you've had it for 10 years, and you took the vaccines, and they may or may not have played a role to accelerate it, but it was detected. Now, once it was detected, for it to be essentially held at bay with the alternative therapies, including the vitamin C, the mebendazole, fenbendazole, and ivermectin, I think those probably had an anti-neoplastic role, because the average person would have metastasized over 2 years.
Well, even before COVID, when I started to treat COVID people, I was taking ivermectin in 2021 continually, even though I didn't know I had cancer for those 2 years, on and off type of thing, as a preventive, because I didn't want to get people sick. I didn't want to get myself sick, so I took it at a low dose. So
Wow.
We'll never know, but to me, it's a gift. I remember when I first got diagnosed, I came back and I pulled the staff around me. And I said, this is the greatest gift I could ever get, and there's no other place I'd rather be in the world than with you all here. And here we go.
Now, Kirk, let me ask you something. Did you measure your antibodies against the spike protein?
So I didn't do that till was it early this year? Let's see. It's been I think I've done it 6. Yes, I've done COVID antibodies. I started off with 7,500 or 7,700. Now they're down to 63, 64.
Oh, nice. Over how long? How long?
It's probably about less than a half year. But here's the thing, I know you've encouraged. So I've always taken the nattokinase, curcumin, and bromelain, probably in higher doses, except for the nattokinase. I start to bruise sometimes, and so I've taken those, but I'm working now after I listen to you all the time, empty stomach, because after a while, when you're taking your nutraceuticals for cancer and you're taking your 5 or 6 medicines for this, and it's hard to find a space where there's an empty stomach. Right. But I'm really working hard at taking those nutrients, and now I'm using the ultimate spike detox because it's just easier. So I'm using that, but it's easier for me to just take it as soon as I wake up, throw the pills in, and swallow them.
Let me ask you, Ron, the Ultimate Spike Detox from the Wellness Company, that's the gold label bottle. How many capsules a day are you taking total?
So I'm taking 4, but I'm adding. So the reason is the nattokinase, but I tend to bruise, so I'm taking 4 of the Ultimate Spike Detox. So what I add is maybe a little extra bromelain and curcumin. Because those aren't at high doses in that product. The nattokinase is what's the high dose.
Right. Now, we also remember bromelain prolongs the prothrombin time too, so that has an anticoagulation effect. Now, I saw a man today who his family thinks that he was surreptitiously vaccinated in the hospital. He was hospitalized, he's got severe heart failure at baseline. But anyhow, he's got spike antibodies of about 6,000, and he's at severely reduced heart pumping function. And he's taking the Ultimate Spike Detox, but he's taking 4 capsules twice a day. And I can tell you, he was covered with bruises all over. In fact, I had to take him off his aspirin. I said, the aspirin's too much. We need to back down. And I think when people get bruising, that's too much. We've got to back down on the dose. So I think you're doing the right thing.
Yeah, no, I watch. I mean, I'm watching my patients too. The bruising is it, but I mean, I've had I've had so many IVs and things that I'm very well aware of my body when it happens. But I'm
Mhm.
watching that, and I feel confident. I'm not as worried about the spike protein. It's going to go down. I'm feeling the best I've felt. I had actually a hernia develop from the surgery,
Mhm.
um, an abdominal hernia, and then I had a repair of that 2 months
Mhm.
later in March. And so my activity was, I couldn't do certain things, but now I'm getting back to it. And my hemoglobin's finally up. You run a 9 hemoglobin, plus you get a little fuzzy from
Yeah.
the ivermectin, and you could fall down. I mean, you could. I mean, I experienced some weird things, but now I'm feeling good. So
No, no, Ron,
anyway,
I'm sorry, Kirk, did they do a laparoscopic approach or did they do an open
no,
surgery?
it was an open surgery. And
Okay.
me, when a surgeon says, bed rest and walk slowly and get up slowly, I I tried my best. Let me put it that way. But I don't move slowly, even if I'm sitting here doing a phone consult in
Mhm.
the office. And I probably hurried it a little too much. So,
And did
but
you have to have a colostomy bag?
no, 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 not even close. They were concerned. So when he went in there, they were concerned because I had lost so much weight they couldn't see on CT scans. Um, I had no fat in my between my organs. So they couldn't tell if another organ had kind of been invaded, like my duodenum. They were concerned that my duodenum had got the cancer, and then that was a whole another experience. And they couldn't see it from any of the scans. So when I went in for the surgery with him, he said, I can't tell, but if it needs to be repaired, he could do it. Other people couldn't do it. They'd have to send him to another tertiary center to do it. And
Now,
I was
now,
like,
uh, uh, how much weight did you lose total?
since August of 23 is really when it
Okay.
kind of, I know I had it then. I was probably 165, 170, and I got down surgery date. There's a picture of me at 138. But they made me, I mean, I was in the hospital 4 days on a liquid diet, so I probably lost another 5 pounds. But,
And how
um,
tall are you, Kirk?
well, I used to be 5'10", but now I'm 5'9". So right now I'm 5'9" today, 155. I did some fasting last week. I do fasting once a month. It's called the fasting mimicking diet to stimulate
Mhm.
autophagy and stuff
Eh,
by
And
Walter
how long
Longo.
do you fast for?
So the fasting mimicking diet is you might really want to interview this guy. So he's world renowned at USC, and what he's done is he's shown that you go on. It starts at about 700 calories. It's plant based and goes down to 650, and it puts you in a fasting state on day 3. And he uses fasting around chemotherapy.
Hmm.
So the fasting around chemotherapy, the good cells go into senescence. The cancer cells don't care, so they get zapped harder by the chemo or whatever it is. And he's
Mhm.
doing studies all over the world in cancer
Mhm.
centers. So it's called prolonglife.com. I'll send you a link, but he's very scientific and valid. His name
But,
is
but,
Walter
so,
Longo.
but for how many days do you do it?
5. So it's a 5-day fast. But during that whole year and a half experience, I did water fasting for 6 days with 1 cup of coffee. I just couldn't make it through the clinic without on a water fast with 1 cup of coffee a day. I did a
Now,
so I
hang
went
on.
I
So
went
the water fast was when you did water fasting, it was for how many days?
I did 6 days once, and I did 11 days. But this is where I was scared to death. I took a trip to um, Thailand, and getting on a plane, everybody's saying you're nuts, you're crazy, blah blah blah. And one night I ate I really let myself go and eat for over there, and I could feel a mass literally in my stomach. I mean, I go, uh-oh. So I canceled my trip. I bought a ticket, flew home, and started fasting that day. And it was about 11 days of, like, it was water and coffee. 1 cup.
Mhm.
I'm not a big coffee drinker, like a half cup, and I did that for 11 days, and then I broke it. So I've incorporated, those modified fasts, the prolonged. Probably, I just did one last week. It's very good.
Well,
Probably
now the
done.
current type of fasting, again, just so we can understand, the current type of fasting is how many days?
Would be the prolonged would be 5 days. Very structured.
5? Okay, so 5 days,
Yeah.
and again, what do you have during that 5 days?
Okay, so on the fasting mimicking diet, it's all set up for you. You have food for each day, so it's totally plant based. It's high fat. It's like a nut bar. It's like two soups. It could be a tomato soup, minestrone soup,
Okay.
artichoke soup. They're pre-made. There's kale crackers. There's olives. So it's designed to put you into a fasting state, and by day 3, where you're in modified
Right, and then and what
ketosis.
happens on the next 2 days? Nothing?
No, you eat those foods, and
Okay.
then but you're and depending on who you are, because I don't have much fat on me, like like it's a little harder. But people go into a fasting state, and then you break it, and I'll probably do that as part of my next year, as a part of a way to it autophagy scavenges up spike protein. We hope we're
Mhm.
crossing our fingers. Autophagy scavenges up old cancer cells. Autophagy is what it does, and he's probably got the most science of almost anybody in fasting. You'll see if you ever just
Well,
get a hold
the
of it.
reason why I'm asking all these questions is I'm trying to figure out I think it's about a 35-pound weight loss. Of the weight you lost, how much of it is just, intentional through fasting, and how much of it was basically weight loss due to the cancer? That's clinically what I'm trying to figure out.
Yeah, well, it was the cancer because I was malabsorbing. I mean, I not to be graphic, but I didn't have a normal bowel movement for over a year and a half. I mean, it was we were so it was malabsorption. And finally, like the last month is the first time I have not been anemic. Like my ferritin finally got up to 50. I mean, I was running 9 and I was running ferritins of 5 and 6 for months.
Mm.
And so in the last 2 or 3 months, I've liberalized my diet, um, and it's come up. Like today, I just I had a 50 ferritin. I mean, that's a dream for me. I mean,
Yeah, I like to run ferritins in my patients at 200, to give you an idea. So
I'm
ferritin,
not
just so
saying
people can know, it's kind of like a storage tank for iron. Are you taking any iron supplements?
no. And so here's the dilemma. All through my career, people caution about iron free radical cancer. So I didn't take it. I'm not saying that's right or wrong. It's just that was a concern. And as I was trying to, when you're trying to manipulate, this is not, I mean, doing this type of cancer work was a full-time job. And there just isn't a lot of time when you're taking
Mm.
those pills, those nutraceuticals, and then you're trying to work. And so um, I've done a lot, and not as much as I've shared with you. I've done a lot more, but
Mm.
I'm back. I'm back, and I'm really confident that I just got to keep changing my head. I that's the biggest part, I think. I mean, we all want to look at the physiology and we want to look at the vaccines and such, but I did some mind body work with a Dr. Joe Dispenza, a very famous chiropractor, on meditation and stuff, and it's about changing your thought patterns, because I believe thoughts are energy and frequency, and they create reality.
It's an incredible story. So congratulations. And you get to about 5 years. If there's no recurrence, you're free and clear of this. But I think it's a tremendous vignette. I mean, I would conclude by saying you had the cancer before the pandemic. You took the vaccines. It may have accelerated it to the point, but certainly you got to the point of discovery. Probably your naturopathic or holistic approach did hold the cancer at bay. Thankfully, you got it out, and with no metastatic spread now, you should be. And you didn't have a colostomy bag, which is wonderful. You should be in the driver's seat now, working on your fitness, nutrition. You should be in good shape.
Yeah, well, I'm working on fitness nutrition in my head because that's the most important part.
That's true.
So
That's true.
truthfully, my interview with you was one of the most healing things that I have purposely put in my life. Starting these substacks again to get back. I did 1,200 interviews in a past life in print. This was in the olden days, up to 2016, and that was
Wow.
my journey in integrative medicine. If you go back to if you find some old timers, you ask them about clinical pearls. And that was a publication, a nutrition research publication that I started. But part of it was doing interviews. But in that day,
Mhm.
you would fax the interview questions over to somebody and then fax them back. And I had 1,200 done. Doing interviews like this, sometimes I'm not as articulate as the interviewer or knowledgeable, but I know how to have them share what I think they want to share, that I think is very, very important. Like you, do you have a photographic memory? Didn't somebody say that? Or
No,
no,
I just get up early in the morning and work hard, but no, I don't have a photographic memory.
But my goal is to, I understand. Sometimes I can't explain. So for example, if we talk about the difference between the spike protein that was manufactured by the messenger RNA and the regular one, and then you say something about the pseudouridine and substitution, I get confused about that. So I let people like you say that, who are confident about it, who understand the biochemistry, but I understand the principle. So my gift is to help people get information that I think is credible, and then they can do whatever they want from people like you that I think are credible. And then, one of the things so I've been in this medicine a long time, where we were always censored in a way. Vitamin C and cancer. I was back in the days of Pauling, when Pauling was at the Linus Pauling Institute. My mentor worked with him. And in that day, same thing happened. Charles Mortel came out with a study after Linus Pauling said, with Ewan Cameron, the British cancer surgeon, we gave 10 grams of oral vitamin C or IV to these terminal cancer patients. And they noticed some improvement, longevity. They didn't live or get rid of the cancer, but they noted improvement. So Mortel does a study at I think it's the Mayo Clinic. Yeah, Charles Mortel. It was a classic, and right afterwards, and debunked it, just, ripped it apart, went after Linus Pauling. So in our medicine, I was kind of used to that for nutrition, So all I did was I went into peer review medical journals, so no one could criticize me and say, here's an article on asthma and magnesium, okay, or atrial fibrillation and magnesium natural calcium channel blocker, and it's in a peer review journal. I would just share it back with people. But we always had a kind of, people kind of censored what we said. So when COVID came around, this is full circle. When COVID came around, and I started, I had a patient of mine ask me, where do you get hydroxychloroquine? And I go, I don't know anything about it. So I'm, looking up Didier Raoul, and all of a sudden you see a video and they're gone. It's there and it's gone. The censorship. You were gone. I mean, I would go, and all of a sudden you're gone. That's why I think COVID's the gift, because that is happening not just at a micro level in our medicine. It's happening at a macro level, i.e. Charlie Kirk and whatever's happened, and that kind of macro level. And mass censorship. And that's why, no matter what you think of Elon Musk, when Elon Musk allowed you all to be back on, that we could share that information, that was, to me, probably one of the greatest gifts that ever happened, because at least there was another side that people could compare to. So I like to share information that I think is good, and this is part of it. I mean, to this day, I can walk across the street, and I walk into the pharmacy, Safeway pharmacy, and it says, get 10% off your groceries if you get a flu vaccine or a COVID vaccine. I mean, it's just like, sometimes I feel like I'm a schizophrenic, because people don't see that. So sharing information is really what I love to do. I like being a clinician, but if you can help 1,000 people get looking at their spike protein antibodies from interviewing you, and I'm sitting in front of somebody trying my hardest to help them put 5 or 6, treatments together for a multi-purpose approach against cancer, you weigh out the good. I mean, I like individual things, but what would be more profound if you could snap your fingers and stopped the COVID vaccine, just took them off the market right now? That would be the greatest health event ever. So there's a schizophrenic world. We're in front of a patient. We're working really hard. You're helping one person, maybe, if they get everything, their ducks in a row. And yet all you need to do is just take these vaccines and get rid of them, and then start helping these people that are sick on a government level. So I see it, but anyway, that's what I'm driven for. So here, so if you'd like to do this, I'd like to talk about the spike protein diseases if you have the time.
Let's talk about it. Certainly, the spike protein that you get from the infection, SARS-CoV-2 infection, and from the vaccines, and most people have had both, the spike protein builds up in the body. The spike protein is the spine on the surface of the virus. It was engineered in the Wuhan Institute of Virology. It's not a natural protein. It's not broken down by human enzymes. Fortunately, it is broken down by nattokinase and bromelain. Probably is broken down by sereptase and lumbrokinase, probably, and potentially papain as well. But we know the enzymatic approach is the way to go. There are some emerging data that maybe augmented N-acetylcysteine denatures it in a way that the body can clear it. But despite a lot of excitement there, the company that holds all the data has not, produced any of that for us to evaluate.
Let me ask you a question, because there's a confusing part. So the spike protein from the natural infection, that is different than what the messenger RNA tells our body to make. And I think if you can explain that difference, I think it's important. I know that we're treating people who've just had COVID infections by themselves for the spike protein. They come up sometimes, but can you tell the difference? And is the one more lethal, I guess is what I'm trying to say, or more?
Well, can you just give me like 5 seconds? I'll go to my treatment room and get my model. Just give me a second.
That's what I was hoping you do. I just put that video up, actually.
Okay, give me 1 second.
No problem. Well, folks, this is a great pleasure to be able to interview Dr. McCullough. I didn't expect it to be about my cancer, truthfully. I have 50 questions for him on the spike protein and spike protein related diseases, but this is perfect. This is really what it's all about. This is about learning, and I know the ball he's going to get, and he's going to explain the difference. And it's very important to, I think, know the difference between the spike protein and between the one that the vaccine creates and the one you get from a natural infection.
Okay,
I just saw
let's
somebody.
go over this. This is the spike protein. When you get the natural infection, you just get the tip of this. You get the very tip of it, the S1. When you take the vaccine, you get the whole thing. And these are spike proteins. The virus is loaded with these. The vaccine loads the spike protein in the body. And once you take the vaccine, we've had one of my patients, he still has circulating spike protein and circulating messenger RNA in his body 3.2 years afterwards. So it's important that we got to get rid of this spike protein. And how we do it is with this. This is the ultimate spike detox from the Wellness Company. You can buy the individual ingredients online on Amazon if you want to. There's other companies that make it, but I'm the chief scientific officer of the Wellness Company. And the ultimate spike detox is kind of the standard. 2 capsules twice a day is the starting dose. That'll deliver 8,000 units of nattokinase. And then, under doctor's supervision, I push it to 4 capsules twice a day on an empty stomach. That'll take it up to a total of 16,000 units of nattokinase. So that's what I do in my practice. And Jordan Vaughn, who's running the largest vaccine blood clot center in Birmingham, Alabama, he's using out of the gate 16,000 in natto. But at this level, as Kirk has said, it is a medicine. It is a blood thinner. And it is dissolving blood clots for sure. And it's dissolving spike protein big time. That's the reason why your spike antibodies have already started to go down. And remember, your spike mass is probably way down, and the antibodies are a trailing indicator.
So, but is not the spike protein that the messenger RNA has our body create, is that not more toxic than the natural infection? I mean, it is sent in lipid nanoparticles, so it goes places we don't have any idea, correct? I mean,
right.
It goes
and
in ovaries,
Kirk, you got your cancer out. You should have the doctors stain your cancer for spike protein and also do a qPCR to detect Pfizer or Moderna right in the cancer. I bet it's right in the cancer.
So is it harder then for people who have had the vaccine to lower their spike protein than it is for a person who just get natural infection?
Yeah.
Okay.
If you've taken the vaccine, it's way higher. So the average person after the second dose of Pfizer, Moderna, they're at 11,000 spike antibodies. The average person with the infection doesn't even get over 1,000. Now, if you had just had the infection, you have long COVID. In a recent paper by Barham and colleagues, they showed that the average person's around 2,000. That was like me. I had COVID probably 3 times, one time documented. but I was at 2,300. My ears are ringing. I didn't feel so good. So I had to go on the detox myself. I took this 2 capsules twice a day for about 9 months. And I dropped my antibodies from 2,300 down to 900. So I feel much better.
So tell me about, let's talk about cardiac conditions that are aggravated by the spike protein. So have you, as a cardiologist, have you seen more of the same vascular illnesses, more complicated, like blood clots, AFib, myocarditis, pericarditis? Are they in the same frequency, or are they happening more in the post-COVID and current vaccine era? And then are they more hard to treat because of this exposure, do you think?
Well, there's a whole new category of cardiovascular disease. It's myopericarditis. So it's inflammation of the spike protein in the heart muscle that occurs after the vaccine. And then there's fluid around the heart. So that is very common. It's associated with blood pressure going up and down, passing out, palpitations, and chest pain. Some people have chest pain for years after the shots. You know, if they get acutely sick and are hospitalized and have elevations in cardiac troponin and EKG changes, that's called acute myopericarditis. And the one that just kind of smolders for years, that's called subclinical myopericarditis. And you put that in your chart, COVID-19 vaccine-induced subclinical myopericarditis. So those 2 conditions now very common. There's been 3 studies done, one by Mansugian, one by Bergen, and one by Pfizer. And it's roughly probably about 2% of people who take the shots, develop that acute myopericarditis. And then there's a paper from Taiwan showing maybe 25% of people have cardiovascular symptoms. So those are common. I think they will improve over time. Virtually every patient I have has gotten better on this over time. But the myopericarditis and the subclinical myopericarditis, it needs ultimate spike detox plus a prescription from you, Kirk, and that's colchicine. Very important. Colchicine is a drug we use for gout. It was used extensively during COVID. It's a natural product. It's derived from the petals of a purple flower, and you just prescribe 1 pill a day, 0.6 milligrams a day, but it must be for a year. So you should be prescribing a lot of colchicine for all these people with palpitations, chest pain, spike antibodies, certainly over 5,000 with cardiovascular symptoms. They need colchicine.
So let's talk about that for a second. You're screening blood tests for someone you're suspicious of vascular injury. Maybe it's not clear. So D-dimer, troponin, galectin-3, BNP,
yes,
serum magnesium. That's it. CRP.
Yeah, that's the bundle. That's the bundle right there that we use, and of course the quantitative spike antibodies. Right. And the troponin would pick up acute myopericarditis. That's pretty rare. BNP is going to pick up early heart failure, and galectin-3 is kind of the go-to to see, was there really any traces of any cardiac effects of the vaccine? And so it helps you integrate all of that. That's a baseline standard of care. Of course, I do an EKG in the office, and then I do an echocardiogram in the office. So I do a pretty comprehensive eval.
Is the galectin-3, does it relate to the stretching of the heart muscle? What makes it, I don't understand, what makes it remarkable? What's
galectin-3 is actually a marker of fibrosis, meaning there's been some inflammation, and now it's laying down collagen basically inside the heart.
All right, so that meant it had some injury.
Yeah, but BNP and galectin-3 are FDA approved markers for heart failure.
So let me go back to troponin for a second, because I do, ever since COVID, I do troponins and D-dimers on everybody. And so all of a sudden, there's a normal range, but most cardiologists don't care about it because it's not in the heart attack range. Now, the heart attack range is in hundreds of thousands when you get a troponin elevated. I'm not sure. What is it? When you have a MI, what level is the troponins at? Are the troponins
Well, I mean, the upper limit of normal on the new high sensitivities are, different from assay to assay. I just had a patient recently in the hospital, and the upper limit of normal was 45. With a heart attack, we can see 100, 1,000. on this because it can go
Right.
sky high. Troponin is the most abundant protein in the human heart. So when the heart's damaged, you get a big signal in the bloodstream.
Right. So the normal request says less than 6 to I believe it's 12 is kind of mid normal, and then 12 to 22 is the higher end of normal. So
Okay.
I've had people in the 20s, and so I tell a cardiologist, and they just go, well, they don't care. They don't. It's nothing to them. So that would be a case for if they had the symptoms colchicine.
Yeah. Oh, for sure. Yeah. They probably have some clinical myocarditis. Put them on colchicine for a year, put them on ultimate spike detox.
Um, Let me know when you're ready to go, because I think I spoke a long time. But
Well,
in the
let me
very
just give you a few other, answer this question more fully. So that's acute myopericarditis and subclinical myopericarditis. Clearly, the spike protein accelerates coronary atherosclerotic disease. So we're seeing more patients with angina and acute myocardial infarction. And this is in the published literature. It clearly can provoke atrial fibrillation. So we're seeing more atrial fibrillation. In my field, it worsens heart failure. So somebody already has a weak heart, it makes the heart weaker and they get clinical heart failure. That's what I had today in the office. And, the spike protein can, induce a dissection, a carotid dissection, aortic dissection, a tearing of the blood vessels. And for sure, the spike protein causes blood clots. The spike protein is found in the blood clots. It's the cause of all the tremendous blood clotting we've seen today. I had a patient who took the vaccines, developed blood clots in the legs, shot to the lungs, had to have emergency procedures to dissolve the blood clots. Now the patient's on ultimate spike detox, and it's been a couple years. She's been perfectly stable, and she's also on blood thinners. And now we're almost at the point where we can stop the blood thinners.
So you use blood thinners plus the ultimate spike detox and aspirin at a time, and
Yeah,
sometimes.
when you do all three, or aspirin or Plavix, and plus blood thinners like Eliquis and spike detox, you're really, really raising the risk of bleeding. So in this case, this woman was on warfarin because she had a specific blood clotting problem from the spike protein called the antiphospholipid syndrome. So she was on spike detox and warfarin. And I think we're very close to being able to stop the warfarin now. So we're just going to recheck a few more things. So we're just about done. But it's my experience is the blood thinners themselves don't dissolve the blood clots. It's very important. You need the ultimate spike detox to dissolve the blood clots. The blood thinners are just holding coagulation at bay.
So tell me, aside from, and we'll try and wrap this up for you, but so you have somebody that's got a heart condition, whether it be atrial fibrillation or myocarditis, and they're on colchicine, let's say, and then they're on your ultimate spike detox. Do you have some favorite nutraceuticals that you kind of always give heart patients? Let's say a CoQ10 or selenium or
Yeah.
whatever. What are your favorite top 3 or 4?
Yeah, let's go through them. Many of them are in Healthy Heart, which is offered by the Wellness Company, but let's go through them. CoQ10 or ubiquinol for sure. I like 800 milligrams a day. Okay, there's a recent review on this. 600 milligrams a day clearly influences all-cause cardiovascular mortality. So I use 800. I like the vegan 800s. L-carnitine, 500 milligrams minimum. Selenium, 200 micrograms. We like the full suite of B vitamins and thiamine. Beetroot extract. So all of that is in Healthy Heart. So we can cover a lot with Wellness Company, Healthy Heart. But the human heart, the myocardium, does need nutraceutical support, particularly in the setting of vaccine, myopericarditis, or heart failure.
Right. So any pearls for AFib? Do you use a higher dose of magnesium because it's a natural calcium channel blocker along with those nutrients, or any other?
Yeah, again, AFib, hopefully it's not something that's going to be permanent. We go on ultimate spike detox and colchicine. Remember, AFib is a manifestation of inflammation of the atria, particularly in the setting of taking a vaccine or post-COVID. And if the AFib burden is not high and the other risk factors are low, we don't have to use blood thinners. We do use aspirin as the main blood thinner, plus the spike detox. I like using magnesium because most of the water supply in the United States is magnesium deficient. I like magnesium malate. You can remember malate for myocardium, malate for the heart. I tend to go pretty high dose, 800 to 1200 milligrams of magnesium malate to get some control, over this paroxysmal atrial fibrillation. I did this in a patient today. So,
do you ever have people do? I know you're encouraging exercise. You said sweating to get the spike protein out. Saunas, far infrared saunas. You ever have any experience with that?
Yeah, I encourage, messenger RNA and spike protein have been found in breast milk, 2 papers by Hannah and colleagues. So for sure it comes out in sweat, Kirk. So you want to be sweating this stuff out of you. Texas, it's very easy. I work out, I sweat like crazy. If I could, I'd go to a sauna, infrared sauna, but you want to physically sweat. It comes out in sweat. I think that's one of the reasons why the athletes have done pretty well with the shots. After this initial wave of mild pericarditis and tragically cardiac arrest, the athletes look fine now, I think because they've sweated this stuff out of their body.
And of course, give me 2 quick comments. One on when do you think, if ever, we'll have the vaccines pulled off the market? And 2, what's your gestalt on immunizations and what will come up from? I just heard Tylenol today, but that didn't excite me that much. But just on quick 2 comments on those 2 things.
Right. Quickly, the COVID-19 vaccines meet all the criteria to be pulled off the market. In fact, they did in January of 2021. It's a great disappointment through Trump and Biden and back to Trump, the administrations, that they haven't done it. No country has pulled them off the market in the world. I think they're here to stay despite the disastrous results of the vaccine program. The main thing is that no one's taking the vaccines anymore. That's the main message. Whether the government offers them or not, no one's taking them. Now, the routine childhood vaccine schedule is being examined, honestly, because of this rising rate of autism. The vaccines have risen in concert with autism. Today, Trump had a press conference. Trump said that he thinks the vaccines ought to be spread out and delayed and get the mercury and aluminum out of the vaccines. Mercury is out now, but aluminum is still in many vaccines to be removed. And then there's some commentary by RFK and Macri and others about Tylenol. So there are some studies, they're not good ones, but studies that may link Tylenol administration during pregnancy, during childhood to autism. But, it's my perspective is it's not the Tylenol, it's the reason why Tylenol is being used. It's called confounding by indication. So a leading cause of fever in a pregnant woman is taking vaccines. A leading cause of fever and discomfort in a child is taking a big battery of vaccines. So we're going to need to see a lot more work on this. Tylenol's been around for 60 years. It's in and out of the body quickly. A baby at age 2 has complete, adult level clearance mechanisms for Tylenol. I don't think it's the Tylenol that's, quote, causing autism. It's probably what the Tylenol is being used for. Sadly, they're putting out messaging today that, warnings to all the doctors, don't use Tylenol during pregnancy, and you can't use ibuprofen or naproxen. And so I think there's going to be a lot of obstetricians and others who are going to, start to get uncomfortable with this. But, the data in total is about 200 papers that support this. It's probably combination vaccination that's a risk factor for autism. And there's now 13 studies that show a child born today, like you used to be, who takes no vaccines at all, is much healthier than the fully vaccinated counterpart. So for me, I took a ton of vaccines in my life, a total of 69. I'm not taking any more. I'm done with them.
Yeah, well, so that'll be a good plug for your book, the bestseller, the New York Times bestseller, Vaccines, Mythology, Ideology, and Reality with with John Leake. But here's a serious question. Your son went through medical school, or he's doing an ER residency or something like that?
Right, yeah.
Right. So what advice did you give him? Because I'm sure they made him get vaccines, correct?
Sadly, he never asked me. He took 2 shots in January of 2021.
Right.
Then it was a year and a half later, reluctantly, he took a 3rd to try to get his external rotation. He hasn't taken any more. We've asked him to take a detox. He's done that. He's a terrific athlete. He's sweated like crazy through all this. And thankfully, don't see any problems. But I wish he'd get his spike antibody measured. We're going to visit him this weekend up in Pittsburgh. We're going to bring a ton of spike detox and talk to him and his wife about it. Listen, Kirk, I've got to get going to get on national TV.
All right. Take care. And I want to thank you, the audience, for listening to this edition of the Staying Healthy Today show. Until next time, stay and be well.